Hello, myself Dr. Nitin Thorve. I welcome you in Nidan COVID support. This is a serial bulletin regarding COVID. So many people were asking different questions about Omicron. Everyone is talking about Omicron. What is Omicron? Omicron. So basically, Omicron is nothing but it's a new mutant of COVID virus. We have almost since last 2 years we are seeing different variants of COVID. Next question of people is like, who should be worried about it? Because everybody is worried, and whether our children will get affected, elderly people are at high risk or not. There are several questions about the severity of the virus. So I would like to explain regarding this. The majority of the peoples in India have got vaccination, COVID-19 vaccination, maybe of different brands, but they have got vaccination. Many of them have got COVID infection in past. So these two categories, peoples are definitely at very low risk. It doesn't mean that they will not get COVID infection, but they will have mild presentation of the symptoms. Apart from vaccinated peoples, even for children, if we see, so children are getting affected, but they are presenting with very sort of minimal severity. So overall, if we see those who are not vaccinated or they haven't got COVID, so they are a little bit at higher risk, we can say. So I would suggest for these people that they should get vaccinated at earliest. Many people are asking me about whether we should get hospitalized after getting this COVID infection, like previously people were rushing towards hospitals. To this I would like to say that even in past and now also, the peoples who need the critical treatment like oxygen support or ventilatory support, those type of patients should only think of hospitalization. Until and unless they get such type of symptoms, they need not get hospitalized. So many people are asking about, is there any difference between COVID and this Omicron infection? So definitely there is a difference, but the difference is there in the incubation period. Incubation period is shortened from it was up until 10 to 14 days, so it has shortened to 3 days, almost 3 days. Then the viral phase is like the virus, every virus dies after a certain period, majority of the viruses, and inside the body. So that period from start of the disease till the virus is active, so that phase even has shortened, means it was until 9 to 10 days previously. So now it has shortened to around 5 to 7 days at the max. Good side of this is the presentation is quite mild. The symptoms are quite mild. People's need very less hospitalization in this variant. So this is definitely a positive side of this variant, and this is the definite difference. Rather than thinking on what should be the another measure to avoid infection, you after getting the infection, you should try to restrict yourself to a isolated area for at least a week, so that you will not transmit to others, and you should try to see that whatever the best medication or care I should take for myself to get out of this Omicron or COVID infection. This is all for today. Thanks a lot.